I chose this patient after I saw a pattern of diabetic foot ulcers and pressure sores in patients living at an LTAC. My preceptor and I spent quite a bit of time there. He was a plastic surgeon who was very passionate about wound care. This patient in particular was prescribed HBOT, hyperbaric oxygen therapy, after we performed a surgery on him, and I wanted to learn more about HBOT. My patient is a 55-year-old white male with a past medical history of diabetes, diabetic neuropathy, diabetic foot ulcers, hypertension, and morbid obesity. He presented to the OR for wound debridement, and a skin flap was placed over the ulcer on his right foot. The ulcer measured 7 centimeters in diameter and was 1.5 centimeters deep. Like I said, a skin graft was placed, and the patient was prescribed hyperbaric oxygen therapy for 90 minutes a day, Monday through Friday. For the PICO, the population was patients with chronic non-healing wounds. The intervention was HBOT, control was standard wound care, and the outcome was improved wound healing. My article was titled Hyperbaric Oxygen Therapy for Chronic Wounds. This review article was comprised of 12 different randomized control trials with 577 participants. The conclusion of this article was that after the short-term therapy, which was measured at 6 weeks, there was improved efficiency in healing and quicker healing time. However, at 12 months, so long-term therapy, there is no statistical significance with HBOT plus standard wound care versus standard wound care alone. So it also talked about that there needed to be more studies done showing the effects of HBOT on chronic wounds. So when treating patients with chronic wounds, it's important to remember that these patients most likely have comorbidities causing their wounds to have difficulty healing. So in these patients, always consider HBOT as an alternative to increase efficiency of wound healing and decrease the amount of time it takes for a wound to heal. It's also important as a PA to think about the reasons why the wound's not healing well and treat the underlying issues. A lot of times it's diabetes that's being uncontrolled by a patient.